Good morning, Nunvaut. There are still no confirmed or probable cases of COVID-19 in Nunavut. Today, the total number of people under investigation to date is 1,166. 119 people are currently under investigation. I'm pleased to provide an update on the support package for our airlines. I know there were some questions raised last week. As we previously announced, we entered into agreements with Comair and Canadian North to provide financial assistance in April, May, and June to maintain adequate airline service for medical travel services and critical workers into Nunavut.
Ulasakut suli nalunataw si mayohang itok ubalo pasagayaw yohang itok no vajuanak 19 talinik Nunavummi. Ulumi katilimatugi kawisak taw si mayut 1,166, 119 suli kawisak taw ni ipayayak taw si mangito. Kuviatung ulumi to saktit sigaron na kamay kayo tinik kangatayo liriyit pinasawako si ulak to maperiyo kakatayumat. Tayo nalunataw si mayohang yung mga katigayo tihak sumagata. Kangatayo liriyo no Comair Good Canadian North Kullo. Kinaw yaktigo ikayok taw na yaktut April, May, amalo June mut. Tayo makitat siya hulluga. Kangatayo liriyo na mo pinig sakay na hulluga. Ana bila katakto na awla kayalin no tamalo. Ikanayak yakto kayalin no Nunavut.
The government of Nunavut will provide $9.81 million in additional assistance to Canadian North for a total of $15.65 million over the 3-month period, and we will provide Comair an additional $6.387 million in additional assistance, totaling $8.987 million. Government of Nunavut employees who are able are returning to work today, and we welcome them back. Measures are in place for safe return to work, and the health and well-being of our employees is obviously always our top priority. Thank you.
Nunavut government kumito ni sinatut $9,810,000 kakaningaw ikayuti ni Canadian North kunut katilimarlugit $15,650,000 takhino pingasunod. Comair Good kakaningaw gutuniyaw na mayut $6,387,000 kakaningaw ikayuti yun katilimarlugit $8,987,000. Nunavut government kungitay ko tirod naktut utik palelek tik kanayami no ulumi tungasutitabo. Akitaw si mayo hakto at tanang ituko titsaron na hulugit kanuingit sarlot ino katigit saron na hulugit ik kanayak titin no sibulak pautin dartabo.
And just a statement as Minister of Health, as Dr. Patterson has already indicated numerous times, Nunavut's strict border measures are likely among the last of the public health measures that will be lifted or altered. Right now, travel into Nunavut represents the single biggest risk for introducing COVID-19. The travel ban and the 14-day isolation requirements for returning Nunavut are meant to mitigate this risk and keep our territory safe.
Luta Patterson o kakatas si Mamman Nunavut Asego behangitut kilitinut isak taw viulit taw nebo kingulak pangulak to ana hak nang itulak ng mambalit taw kartangin nun manaw yok Nunavut mo tikigun nak nekta nangin ang pangulo ni ulo kaya anak tumigo taw kayang ano ba anak 19 tikigun nang ningani tikigun nang namunok hangati taw yok amalo ulo ni 14 day ulo ni 14 ni nok inutu kay nakahang ng motik palalak tilugoy Nunavut minut tamatuming ulo kay nak tumitailit itsigo tayo yok at tanak tumitailit itsigo tayo lunilo Nunavut minut.
Knowing that, I'd like to take this opportunity to share information on the new process being implemented for reserving stays in Government of Nunavut southern isolation facilities. Moving forward, all Nunavut who must travel outside of the territory should contact the email address nuisolationreservations@nunavutcare.ca and submit an isolation reservation request form as soon as they know their plans for travel.
Taman na hawi madlugo pibihang nito saktit siga kay na umayang ano ta mi ato aktaw galim mik atulot titaw ni akto initially ni akto Nunavut government kungin ni hallo na ni akilik soktangin nito yung mevineno tubio kay nang ni akto ni sibu mugayam ni akto luta Nunavut mute awla kayali Nunavut sila tanut ubo nga kakisaw yakko titira kayalit NU isolation reservations at nunavutcare.ca. Tunisilutik inutukay na kumanang initsaliok tauguti mik titirarealimik hauyimaguti aullarniarnermini.
The travel team will work to identify room availability and reserve your stay in one of the designated isolation facilities. This new streamlined process is meant to help Nunavut plan for their 14-day quarantine period farther in advance and ensures that our travel team can anticipate and accommodate travelers in the coming months. More information, including intake day requirements, can also be found on the Department of Health's website.
Tako aulahattarne mo pilleri hatigitut nalunayay mata ila nalunayay gayang ata illogosong nato inaktahan mga initsaliok tauli gayakto titako nga nalunay taw si mayud ni nalya ni inutu kay nakatabyo yun ito yung mabini. Tanan utak tukimo ataw si matsya to ataw ataw galik ikayoro taw na aktok Nunavut miu pang nagum nahulugi ulo ni 14 nik tuyo may vinne inutu kay nakayang ng minik sibong magugiyak kan lalo na sistema lo ni tako aulak puliri ng mopiliri khatibu nirigum nat sa hulugit init sa haktit sa rum na hulugit utik palyayo ni takhigalaw ni akto ni tukisigat kan na rumagobi hangak kullo ulungin ni isabbigun ng mga tatuyo may bita ko anahan ng ituliri ko kakasaw yak ko tukisigat bingan ni piyagun nakto.
And just to make sure that I can't emphasize enough that non-essential travel outside of the territory is still not recommended. All individuals who are applying for critical worker exemptions will continue to use the email address cphotravelrequests@gov.nu.ca. And finally, the Department of Health has made temporary amendments to the medical travel policy to keep our medical travelers and escorts safe from COVID-19.
Iqamana qhusi tako pimmarayung itunik aulagut iqaqtu Nunavut sila taanut suli atulikhuyawngin man kikutuin na itut siraqtut iqqanayartiu nermu pimmarayuningin angiqtau gumagutik suli uvungat titiraqunaqtutut siraqlutik cphotravelrequests@nov.nu.ca kinulak pamilo anahan nang ituliriyik tako aqitsiga kay naqsimayut anarbilartunu aulaqluti atuaganginnik Takwa nerbelak tuti aulak tut baliting ilo at tanak tumili kunagin uwadyoanak 19 mo.
Specific provisions have been added to ensure that medical travelers and escorts abide by rules of social distancing, hand washing, hygiene, and other behaviors that help to prevent the spread of COVID-19. The amendments also more clearly outline the requirements for both medical travelers and escorts to complete 14 days of self-isolation at a designated isolation facility prior to returning to Nunavut.
Tako ilulingit ilayaw si mayut atuagang no tako ana belarlutik aulaktut malitting ilo maligiyahang ata atuagang nik inu hatigit khanigilo at iligiyahang ninginik agamin niwasay na hataraham ng mut asingilo piliridyo sa hasulutik sa mapadle ako nago nuwadyoanak 19. Akigataw si mamiyo tako ato kisinat siya hulugit malitaw gali tamakin anar belartunik aulak patuno malitingin nulo ulo ni 14 nik inutu kay nahatara halutin alo na itaw si mayuni tuyo mibinin alo na itaw si mayuni utilawngin ningin ninunabom mo.
As we continue to look at ways of easing public health measures and returning to the activities we enjoy, we must remain diligent and aware that the threat of COVID-19 has not yet passed. Please continue to maintain physical distancing and hand washing practices and limit any non-essential travel out of the territory. Thank you.
Suli hayo balega so atiluta khasiya balega so ninginik ana hamnang itulo na mamalita huya yut utik balega so atiluta lo kanu ile utik tin no huya gayatin not suli ujjo sutsara haktigo tamanna kapya nam ninga no badjo nak 19 suli tamanna mat tikigun nam ninga ino khatigi khanigi to lo tele khatarlik suli amalo agasi wasay na khatarlugit amalo awla ga hangikut si awla khatangillo si no nabo sila tano kuyan nami
Ken Driscoll, APTN National News. Minister Hickes, aside from their continued operation, I'm wondering what sort of benefits or concessions you were able to get from the airlines for the significant amount of money you're offering them.
Ken Driscoll, APTN kuno Minister Hickes tako sila tago kina yanik kayo sa tamning inno ta ko hangata juligit kisuni hakaninga good pibalero te kalanga gisi.
I don't know if concessions is the right word, Kent, but basically to maintain at least the level of service that they're at right now. I know I was speaking to the president of Canadian North last week, and they actually added another flight to the Rankin Iqaluit as we're moving more medical travelers in territory. So just that continual dialogue to make sure that we're meeting our minimum requirements with making sure that they remain liquid, solvent. Thank you.
Tako ay kayo tiyo laking ito galwa kisene tayo maaula taongin na kullugi piyik sa kautingit. Tanaw hakatigayo yakanga yakanga Canadian North ko pinasa ako siyo jujume. Ila sikan na simalekto ataw sumikanga tayo ila tiki khatak to me kanga sinak me kikalunut. Tako aner belek taw lang naksaw katalang at tabang ngak to tamaw nga. Tako ila makitat sa akong na kullugi amalo tayo makatatuin na ako nagi tayo may kayo to haktugo.
Today's Government of Nunavut Back to Work Day. Now, I know it's still early, it's still only 9 o'clock in Cambridge Bay, but I'm wondering, have you had any sort of indication as to how many employees were able to come back as hoped?
Lumino na wagkaba makungyo tilang atay kanaya binut kaway magalawak to ilang ipigali tayo naktunay mo tayo nang kalutut charme. Tako hatsibo tiktik kanayakti.
I don't have any numbers, Kent. Little, like I said, it's a little early. I know there has been a number of people expressed to me out in the public on how excited they are to get back to work. I don't know if that's from increased respect of teachers of having to homeschool their children and wanting to get back to work, but I know it's been highly anticipated and very much appreciated. We rely so much upon our civil servants.
Tuning in the how you mangit to a kilame ulangat. Kisano how Joe had the law to Rodako, who were near to Nick and I am no mutila to Nitako, Lily now to Sakata, Meriton, I mean Nick. And a customer to enough to Titako, who were to Kanaya Lang, no minute, who yelled Sato, Nunavut illa. Kavamakune Kanaya Titin.
My next one's for Dr. Patterson. Dr. Patterson, I had a chance this weekend to see some photos from one of the quarantine hotels, not a Government of Nunavut one of the federal ones they're using for citizens who are returning to Canada from outside of the country. Looking at some of the preventative measures they had there, they had plastic on the floors, in the hallways, and on the walls. And they also had people in full hazmat gear bringing food into rooms. I'm wondering, what is I'm wondering about it. I've seen the ones from here in Nunavut, and it seems to be quite a difference in standards there. I'm wondering, are you confident that the Government of Nunavut medical quarantine facilities are reaching that standard?
Luta Patterson, Ajil, Dominum Nitakusima Maguta, Kuning Atoyo, maybe unit, Gavamatohaka, Simayang in the Kanatamin after Nick. Ino tu view kay nakatam na ato ni kanataw sila tani nga sumayunik nating ilo akin nang ilo mga pitat siya sa sumatsak to di kamalo kanayak tingin ni kay gaktok to atot siya to tamak ko nga sapog mayagot ni timili makot takwali no na boga pa makungin nito yung may nayok tangi tay may tu yang mata na ngit siya kli takwa siya makbeu yang iningani.
There's a difference in level of risk and level of concern depending upon the isolation center, and some of the federal government facilities are intended for people who are returning from international travel and are symptomatic, have symptoms consistent with COVID-19. And when that happens, obviously that changes the preparation that you have to do in order to minimize the risk of transmission. I'll literally translate that and I'll comment further.
Ilajyung imata kanu tigi ulunga nakto migo te hamningin isamalun nakto mata ko inu tuti tau ga hamningin pilo akto gava mato hakutama ko tiki palya yuno kanata mo pidyo te hangatali no vadyo nak 19 ne kanu igo tilin no ta ko asid zero tau vato kanu tigi tamako sa pujis magya hamningin no.
We've been working with each of the hotels that has Nunavut in isolation to ensure that there's plans and preparations in place for if somebody is symptomatic to increase the protective equipment so that the chance of transmission is minimized.
Takwa piliri khatigi jaw hatta to kalluna ni to yomi mi nuna gummi no ni gi jaw yuni takwa ino tu beauty taw yuni parnaw ta khas to palonga yaksi mallu talu tay ma khanu tu ya to khalon khat khanu liga to khayam ni nitin ni naluna si bagir si mayugo
Rajni Sharma, Nunavut News. I have a question for Minister Hickes. Minister Hickes, at the protest on Friday, you noticed that some people were wearing masks, others were not. You know, some people are following the social protocols of, social distancing protocols, and others were not. I was just wondering, what are your thoughts on this?
Rajni Sharma, Nunavut News, kunne Minister Hickes takwa Pessoa ya hatigi tu akira tu lu titander me takola tu saga velang ikina me gomatwa semala tu malit cher tu tiktamakut kuninga ilang illo ino hatigi ne khanit salote lejut ilang illo malilo agati khanule tamanay sumagilaqyo.
And I was one of those people who was out there and could not get my mask to fit, so I couldn't leave it on. One of the things that I know I specifically focused on personally was making sure I was maintaining that distance with people that were not from my household. And I know I did what I think very well at it. I think in general, most people were very cognizant or aware of their surroundings and the distancing. I was concerned over the number of people that were still seemed to not take it as seriously as what I'd hoped, and I do hope that people, anytime you're in a setting like that they continue to monitor their own symptoms. And there is on the Nunavut Health's website there is a survey that you can take to see if you're symptomatic and what level of testing would need to be done.
Ilagi jawla to ngatay kuno ngay mga kiratu yuno keso hatigi tunutan na lima to amenina matsalaw imata na atigum na atiglaw ngitanga kesani ino hati mene khanit salawate lilaw to ila khanit salawate lilaw ito kesani ang kami hati minita na kamagit sa surilaw tanga kesani litamak ko khaye matsa ka reali lang isuli malit sa ngilo hatak to takko ino hatigin ni nakata ilangi pimariulo aso itsingin mata kasi anita imali sumalo ga ako yibunga pimariu ning anita makko suli matuik taw ila malit taw ga ham ning hawi saluti khanu ilungi kalo mga amik takwa ana ham nang ituliri ko kakisaw yakub tukisiga bingane tukisiga pitsaw yo kanu ikut khalag na robi kanu igum na kayak mga pinuwadyo anak ta fakso ilang na robi.
And for the record, I am trying to find a better fitting mask.
Jackie
McKay, CBC News. We're getting a lot of complaints from people down in the isolation hubs about construction workers essentially having more relaxed rules than Nunavut residents. Why would construction workers be treated differently than Nunavut residents?
Jackie McKay, CBC Kuneka, Nerlubio in Nahatalang Ataguta Makuning Atoyo, Mevio Unino, two view unitaqa, Illuli of Tisanagar to Malingilo Amning in Nick, Adjung it to Nilo, Maliga Hamning in New House, Hatangata Hanu Patamana.
Basically, in a nutshell, there should be no difference. There were some concerns raised to me last week that there was some confusion on a construction crew from Manitoba that was staying within Manitoba and a construction crew that was coming to Nunavut, but there has been other concerns, as you mentioned, raised over the weekend, and we're looking into it. I can assure people that we take this very seriously. And if people are not conforming to their agreements within those isolation hubs, they could be asked to leave. So people should be very cognizant of what they're committing to.
Residents have said that they are sending a letter of concerns and complaints to you. Can you be a little bit more specific on, besides you're just going to look into it, about like what will be done?
Lalo na sige kan nakakanulat mga pitamatumamit.
Well, it really varies, Jackie. It could be if somebody's really flagrantly flaunting the rules, they could be asked to leave and not be welcome back, and there could be some serious consequences with the employment with their employer to having to restart the isolation. I can assure everyone out there that if people are not following the rules in the isolation hubs, they will not be allowed into the territory.
Hajigi hatang ito Jackie taman na kisani ani titawgon na tserto tama pigiakan na reakhalera so titaman na pimmario yimikso le khanaya meni anna ito na kayangata dalo na bigon na takatamag ko manito na bigit jangin na tigutay mamaling ito isok titawga yang ito.
We've also heard from many people that in some of the isolation hubs, they can go across the street and go into like the local shoppers, or they're spending extended periods of time outside with other people in the hotel. That essentially just the rules have been laxed so much that now people are concerned if the isolation hubs are even working. So have you heard these complaints? And also, how are you going to be able to balance between people not being policed essentially and then also not breaking the rules? Is it up to them themselves to be able to follow the rules?
To saksi mamata makkuning ami sunita makko akhutu yung me vinino tu viuyut sulu nu verbele akatasuti kak khanigi akaluangan no ye gaktar bemut tu yung me viulo silatane akatasuti akuni ino khatigi mine khanes sartu tiato agam ne malelo aktu yarun ne ngata tako atu te khatsala galo kha tu yung me vino tu viu kay na khatak tu tamalo tu saksi mabita matumamit sa no malit titaw sa galo mangata.
I've had some concerns raised to me, Jackie, on people complying. I know there has been some confusion in some of the isolation hubs on just normal travelers, like people thinking that because you're from Nunavut that you're automatically in the isolation. You may not be part of that process, so you can come and go. That being said, we are going to continue to monitor. One of our biggest expenses out of this is security, and we've invested a lot of money into these isolation hubs as that cushion to try and keep COVID-19 from entering on a large scale into the territory. So we want to make sure that this isn't a fruitless endeavor. We want to make sure that this is an investment that's being made to make sure that we are remaining to be, if not COVID-free, at least minimizing the impact.
Sumalo tini tu saksi mayong atak ko malit sa gitu nakataw katang sutik ko Nunavut motik panle ajiging itu katang atay lang ilo tak ajiging itu ni malikat kaya haksurya matakisa ni tay matsay nak malit titsi gaswag na aktugot amalo kinaw yan atok sa mayong makayugat watsi di ham na mukhaw isak di ham na mutay may matakwa Nunvaut 19 Nunavut mo isitay titsigutir matatay may mat ato tikat siya kakaswartin na tabutay ma Nunvaut 19 tiki kunago at tuwi na kalawa kunagulo.
And I'll just add a little bit to that, if you don't mind, Jackie. I think as far as responsibility, we're setting the guidelines and we're setting the parameters and we're, like I said, paying for security. But people have obviously their own personal obligation to this as well too. If you know that you're not supposed to be leaving the premises or going out into where you cannot be safe distancing from other people, you have a responsibility yourself to make sure that you're following the guidelines that we're putting out there.
Ilagay ang lugutak ko pilirat sa kaktin na matatak ko akit sa katang atato at gani maliktaw gyalinik akilik sa yung makiulutin lo kaway saktit sa katan ng mo wat sa kaktit sinang mo tako inuwi minir piyat sa kakalawang atay maanit tayo likatang luti aniga kangit titaw tilugit tayo malo umasigi siya katang luti ino katiminik namin tako tayo ikadyo kaya li tayo mautakit itaw yun taman na siya maktaw tayo likulugo.
From this morning's announcement about the airline funding, my understanding from it is that that amount of money is allocated to the end of June, is that correct?
Correct, April, May, June.
April, May, June.
So at the end of June, you're going to have to renegotiate that funding?
That's correct. So there's a couple of different factors in there. As restrictions start getting lifted across the country, we want to make sure that our airlines also have the stability, but we also want to make sure that basically, I guess in some respects, the complications of the negotiations up to now has helped because it's really solidified the numbers and identifying the needs. So any further agreements I would anticipate being a lot easier to accomplish.
Taman sulit yak ta ko jiging itu mata malo ta ko sulit tabiu tita yamali ta gali kana tami kaso jaw balle alak tilugi tay masuk kat jayingin aksaw nang atam malo makita siya ako na hulugi ta ko ayok na ko tigilaw nga ayok ko taw ning ata suma katsu ning nalo na taw kaso lang atam malo nalo na yaya kaksutas pijik sa kaw tiu galin ni tingod lang ayok nangin naksaw lalak to.
My next question is for Dr. Patterson. This morning, the GN sent out a press release saying that the case of whooping cough in Sandy Iqaluit has now turned into an outbreak. Are you concerned that with COVID measures still in place, a respiratory disease became an outbreak in that community? Does it concern you that what this shows, considering COVID could enter a community, what it could possibly be like?
Luta Patterson ulla tay mata ko kama pipalia yulirin to saktit sigutio yumi sani kilo ami siak balang kataman na huirsok juar nakto isumalom nang katay malay no ba juar nak 19 utalam na kataman na isumalo gibiyo tay matigalo siak magayak mga.
Thanks. I think for all of us it should reinforce the impact of what could happen with any communicable disease when it gets into the communities, whether it's COVID-19 or pertussis.
Kuyan na may nanalo na siya ako tao tuwin nakto kano tigat tuwin nakaroon na ningin ni tamakwa siya magong nakto kisu tuwin na itso lunuwa juan nak na itimot amalo tamato mga huirsok juan nakto mo tayo matigitag ka siya matsaw tigigong nakto.
News. On the same topic, you said last week that you were not going to declare an outbreak in San Iqaluit. What has changed?
Matrantor no na siya kung nitay ko nalo na sila yung inabito bang naktuningin ni sumalita taman na si jitaka.
There's more cases and we're aware of transmission between some of them, so it's now an outbreak.
Amisukan nilang atatay may temeko sok juan naktaksi mayo kaw yung malakso tigulo tayo mataman na siya mapalyan nga ni tayo may manalo na kakalaptang.
Can you tell us how many cases?
Kasi yung mga tao kakong naki.
Less than 5 at the moment.
Talimaw ito nga ni tuman na.
And we know the government of Nunavut is going back into their offices today across the territory. Can you tell me what's different? What does it look like now that COVID-19 is a reality? What is going back to work for GN employees look like today?
Nunavut ka mamakung kanayak tingiyo tilang may matala bimino kiso ni adjiyong ito kakatay ma adjiyong ito ni kano kaw yigayak kaw tilang kami kanayak bimino.
As employees return to work across the territory, not just GN offices, but other offices, other workplaces, there needs to be greater emphasis on distancing and separation, and maybe calling into meetings when, even if you're in the same building, to avoid overcrowding in rooms. Things like that to minimize the impact of any communicable disease will be important and good practice for us to build those habits now.
Tamakoy kanayak biminutak palalak tilugit Nunavut ka mamakung itong ito asing itawi kanayak biyo tilang may mata o jaksut sa kali kanigilo tayo lakatang ng mo imik ko nga naksaw katarlutik o kalautik ko nga lo kati matuwin na katarlutik tayo mga may sulo ang nangin mata kati mabingin ni taman na Siya mapalaya kung nagutay mapili ka Diyos ita ako palagi akan nakinalak to eh.
And one for Minister Hickes. I'm wondering, we've heard a couple stories of people being kicked out of the isolation hubs, and my understanding is there is a process for that person once they're kicked out. My understanding is that they're placed elsewhere, but can you tell me what happens when a Nunavut resident who's supposed to come back to Nunavut is kicked out of the isolation hub?
Tusak sa mamata ko ani taw sa mayon ito yung may benino to taw view kay nakto ni kanok lima liga kalagaya kata ko ani taw nakata to yung may benita ko no bumio to yung may benito ani taw nakata.
Thanks for the question, Emma. It really varies, again, on a case-by-case. Some people maybe just aren't ready for the isolation hub and will stay with friends and family wherever they may be. Other people have been moved to other isolation hubs, even to a different city in some circumstances, to be able to maybe it's the proximity to certain peer groups that might have been an influencer. But in general, we've been able to accommodate, to my knowledge, everyone that does want to come back to Nunavut through the isolation centers.
Adjigi hatang ito ta ko ato ni taktawlo ti kamagilaw hatang ata ilang kaya to na ngilos to yung may mo hatang ata ta ko ani tawga kasakat to ilamin no tawlo ti pehan na yamin no lunin o balon ni asingin no nalipaw yak no ilang yaw lak taw hatak to ima malit siya akong nahulugi kasi ani kayo kasi akong nakasimayo tamako ti rumayo no nabummo.
Ken Driscoll, APTN National News, and this one's a little political, a little medical, so you may want to decide between you who's going to answer. There was some discussion last week about creating a bubble with the Northwest Territories for travel back and forth. I'm wondering where those discussions are at and what would need to happen in order for that bubble to come into existence.
I'm going to say it's more medical than political.
Ken Driscoll, APTN connect taman na niro ikapamalaki ng mga yawan malawan na hamnang itulari ng mo. Tako no natsya mo di maawla katang nang may matirsige sa mayugat si tamako kasiriya sinamilikan.
Thanks. It's still working out the logistics of making sure that it doesn't create a loophole into either territory, but allows easy access to going back and forth across the border. We're still working on it.
So le pili reaga taman na ima sila kidni utiuli khunago tamakkono no na bumu isera so aktono nuna tsermi nuna votu amullu tamakko utikta utikhatta khullewi ajor nangit tokkut sulita ko akhit sakta yeluling.
Rajni Sharma, Nunavut News. Dr. Patterson, this bubble that you're talking about now, what if one territory, either territory, if there's a case of COVID, will that still happen? Like, what's the criteria for to continue to do this?
Rajni Sharma Nunavut News kunnik luta Patterson takwa ima awla khatigi biu khatta gunnak siga yarni nunat ser Nunavut lut khanor lika ma no wajor nak ta to kharne khanat lani tuna so likayu siga yakha kisuni ato gakta lika yakha.
In discussions that I've had with public health officials from Northwest Territories, the consensus is if there's one case in either territory, then the bubble is closed at least until things settle down.
Ukakatigi sumalogita ko na hamnang ituliri na mapiliri yung inunat siya mayang ikatigit sumayuguno ka dyan naktak to kataman na awlak na matuyaw sa utigi gayak to.
Are there also any other discussions of having a travel bubble, let's say with Yukon?
Kay mataw lahat tabigun na kayang ningiyo ka ano kakataw si maban.
Not at the moment.
Agaw yuman na.